Thank you very much for joining us on this live broadcast once again.
Our socials at KBC Channel 1 on X, Facebook, and YouTube. Our sign language expert tonight is Susan Thuku.
Speak to us on those social platforms. We'd like to hear what your thoughts are on some of the stories that we've covered for you tonight. And we begin off with our top story. The Rural and Urban Private Hospitals Association of Kenya, RUPHA, has directed over 600 member facilities to suspend Social Health Authority SHA services effective the 22nd of September 2025. Why? Because of accumulated debts exceeding 43 billion shillings.
The decision means patients under the scheme will now have to pay cash for services, with doctors and hospital owners arguing the move is long overdue.
In a statement, RUPHA Chairperson Dr. Lishenga said that treatment will strictly be on cash basis, except for emergencies and also those critical services.
Joseph Ofungo begins our coverage tonight with that story.
Patients who once walked into hospitals with an assurance of being treated under the Social Health Authority could be facing tough times ahead. The Rural and Urban Private Hospital Association, RUPHA, now says hospitals across the country can no longer sustain free treatment, warning patients should be prepared to pay cash up front.
One of the things that's already common knowledge is that patients, when they go to hospital, are paying out of pocket. This is already common knowledge. In fact, a lot of hospitals were already on strike, and they have been on strike for many months. So it is just that we have decided to come out today and declare that it is there. But this go-slow has been going on for the last 3 to 4 months.
In a statement, RUPHA Chairman Dr. Lishenga said treatment will be strictly on a cash basis, except for emergencies and critical services. He accused the Social Health Authority of being a bad debtor, noting that it has already received credit worth 76 billion shillings, but failed to settle outstanding claims.
Anybody who knows that when you are being conned by someone, you must draw the line at being conned. So SHA has already received credit from us as hospitals worth 76 billion. Surely, how much more credit does SHA want?
The healthcare providers also accuse Health Ministry of ignoring a presidential directive issued in March 2025 to settle claims below 10 million shillings within days. Instead, debts dating back as far as 2017 remain unresolved. According to RUPHA, the consequences of inaction by SHA are already visible, as dialysis and cancer patients are among those forced to pay for critical care.
Some patients in Kisumu who over the weekend were not able to get dialysis, and last week, because when they went to check, they found that SHA inasema kwa portal ya kwamba their sessions are exhausted. So in fact, this weekend, one patient was admitted in hospital in critical condition after a missed dialysis session yake on Friday.
At the same time, hospitals say the so-called war on fraud is being weaponized, with billions of valid claims rejected without clear appeal process. Joseph Ofungo for Prime Edition.